Life is full of twists and turns, and sometimes we find ourselves facing unexpected challenges. Meet Sarah, a recent college graduate who embarked on a new chapter in her life, landing her dream job at a prestigious company. But as Sarah dove into her new role, the pressure and high expectations began to take their toll. She found herself caught in the grip of adjustment disorder. Adjustment disorder is also known as situational maladjustment. It is a psychological condition that can occur when an individual has difficulty coping with a stressful life event or change. Here in Sarah's case, the new job. It is characterized by emotional and behavioral symptoms that develop within 3 months of the event and cause significant impairment in functioning. Some common triggers for adjustment disorder include divorce or separation, job loss, relocation, financial difficulties, or the death of a loved one. Sleepless nights and overwhelming anxiety become constant companions. The once vibrant and confident Sarah started to question her abilities and withdraw from social interactions. Recognizing the need for support, Sarah reached out to a mental health professional who could guide her through this difficult journey. Symptoms of the adjustment disorder can vary widely, but it typically includes emotional symptoms like excessive worry, sadness, hopelessness, irritability, anxiety, or feelings of being overwhelmed. Behavioral symptoms include agitation, restlessness, social withdrawal, difficulty concentrating or avoiding certain situations. And the physical symptoms it includes headaches, stomach aches, muscle tension, or changes in appetite and sleep patterns. Through therapy, Sarah was able to explore her feelings, address her anxiety, and develop effective coping strategies. With time and perseverance, Sarah started to regain her sense of self. She gradually adapted to her work environment and her symptoms began to fade away. It is important to note that adjustment disorder is a temporary condition and the symptoms usually resolve within 6 months after the stressor has been removed or the person has adapted to the situation. However, if left untreated, it may lead to prolonged distress or the development of other mental health conditions. Treatment for adjustment disorder often involves a combination of therapy and support. Psychotherapy such as cognitive behavioral therapy, it can help individuals identify and modify negative thought patterns and develop healthy coping strategies. Supportive therapy and counseling can also provide a safe space to discuss emotions and gain support from others. In some cases, medication may be prescribed to alleviate specific symptoms such as anxiety or depression. Practical coping strategies that individuals can utilize. It includes seeking social support, engaging in relaxation techniques like deep breathing, meditation, etc. Then maintaining a healthy lifestyle, which includes exercise, enough sleep, nutritious food, then setting realistic goals and expectations. Adjustment disorder doesn't define us, it's merely a temporary roadblock on our journey to personal growth and well being. Remember, if you find yourself struggling to adjust to life challenges, reach out for support. Hope you like this video on adjustment disorder. Please like, share, and subscribe. Thank you and keep smiling.